asking you all to actually, I'm going to use that same link. Just kind of explore parts of yourself um, in preparation for some of the anatomy that we're going to look at today in the respiratory system. So the first one was you were just taking your hand and running it up and down your throat. And what a lot of you all described is this kind of bumpy sort of texture that you feel up and down your throat. And if you kind of tilt your head back, you can feel it even more pronounced. And what you're feeling is your trachea. So this is also known as your windpipe. And it's made up of C-ring shaped bones and then cartilage as well. And so as we look at the anatomy of the respiratory system, we're going to talk about the trachea. And a lot of times when I think of the trachea, I think of a bendy straw. So I'm going to show you a picture here. I'll show you a lot of stuff today. Where's the bendy straw that I keep losing? So you guys know those little kind of accordion looking straws? And I'm just going to pull it up just in case you're not visualizing what I'm talking about. But it's very similar to kind of what the trachea looks like. So it's got these ridges, and then it doesn't collapse in on itself, but because there's cartilage, so it has bone and then cartilage in between the bone, it's slightly flexible to where we take a breath, it can kind of expand a little and adapt. And but that's what you're feeling. So in males, because of the hormone testosterone, their bone is going to be a little bit more pronounced here in the trachea, and that's what's known as the Adam's apple. So it's just, there's more pronounced bone here in the trachea. I think it's this one right here. And even like in me, I don't have an Adam's apple, but I can feel that that particular bone is a little more pronounced. Um, okay, so the next question asks you to, I guess exercise, asks you to take a deep breath and describe what you feel in your chest. So you guys fill up your lungs with air. A lot of you describe feeling a sensation of pressure or fullness. You can feel your chest expand. You can feel how it like grows in size as your lungs are expanding. And so for a lot of us, that's kind of what we felt and described. And so as we talk about the respiratory system today, we'll talk about how the diaphragm, there's a muscle that's actually going to relax and contract to help our lungs to fill up with air. And I'm gonna show you a video also of some lungs being inflated, some actual lungs, not the nose hairs. I'm just gonna Here we go. Okay, so we're gonna watch some videos of some lungs actually being inflated, so you can see the difference between a smoker's lung and a healthy set of lungs. But you can see how much they actually expand as they fill up with oxygen. You can feel that in your chest as you take a deep breath. And then finally, I asked y'all to hold your breath for as long as you comfortably could, or as long as you could, and use a stopwatch. For me, it was 25 seconds. That was as long as I could hold it. And different, depending on our own physiology, how our fitness level, it's going to play a role into how long we can hold our breath. For most of us, it was under a minute or up to a minute, which is pretty impressive. I think somebody had like 2 minutes. And breathing is a regulated mechanism. So the brain actually controls when we breathe. That's what it's automatic. We don't have to think about it. As a matter of fact, when we think about us breathing, we become very conscious of it, and then it affects our breathing rate. But if we're at rest, we, on average, take 12 breaths per minute. And so we're able to get in the oxygen that we need in 12 breaths per minute. Obviously, the more we exert our bodies and we need more oxygen, our breathing rate is going to increase. Also, if we're short of breath, if there's pneumonia or something in the body that is not letting us take in as much oxygen, then our breathing rate will accelerate in an effort to get more oxygen into the body. So, and then you can definitely train your body to hold more oxygen. But for most people, 5 minutes is the threshold. So exceeding 5 minutes of not breathing is going to start to cause permanent damage to the body and eventually death. So let's go ahead and talk about the respiratory system. Today we're going to focus on the anatomy. So I'm going to be using the PowerPoint that I linked. And all body systems are vital. So we depend on every single one of our body systems to survive. I don't want to say one body system is more important than another, but like for example, if your respiratory system is offline and not working for those 5 minutes, or your circulatory system, your heart stops beating for the same amount of time, that's like immediate like death within those 5 minutes. Or even your brain, right? Your nervous system, that could be within seconds. If you have some very traumatic brain injury, that's death right away. Other body systems get by you a little bit more time. So maybe like if the kidneys are shutting down, maybe you have a couple more days or weeks. If like let's say the reproductive system, for example, it's if your reproductive system doesn't work, it's other than affecting your quality of life in a way like more of an emotional sense, like we can't, if you want to reproduce and you can't, but not in terms of like your longevity, right? It shouldn't affect how long you live, or unless you have some like serious issues, perhaps like cancer. But like some women will get their uterus removed. It's called a hysterectomy, and as long as they have their ovaries, they'll be able to produce the hormones that they need, right? But like with your lungs, if you have a lung removed, that's really going to affect your quality of life. So, with the respiratory system, it really has just one important role, and that's gas exchange. And so, it's going to go ahead and take in oxygen and remove carbon dioxide. And that's pretty much the only role that the respiratory system has, like the major role. Other body systems have multiple roles. Like if you think of the skeletal system gives us support and body structure. So our physical appearance relies on the bones that make up our face. We make blood with bone. We protect organs with bone. So a lot of these body systems have more than one job, but really the respiratory system is just in charge of getting oxygen into the body and removing carbon dioxide, so that gas exchange. And so we're going to focus today on uh, the main organs of the respiratory system and main structures. And so we'll start from the outside and work our way in. And as we do this, you'll see some of the ones that you labeled. So if you haven't been able to complete this and this helps you to fill it out or just check your work, you can definitely do that. And if you can definitely amend or edit as needed. But let's go ahead and start with the entrance to our respiratory system, which is our nose. So we have those two nostrils, it's our nasal cavity. And the nasal cavity, we can breathe in through our mouth as well, but our nose is specialized to take in um, oxygen or air, but also remove debris. And so our nasal cavity is going to be in charge of removing any debris that's in the air that we're breathing. So if there are dirt particles, pollen, lint, hair, like let's say animal hair, whatever the case may be, as you breathe in, the nose hairs that are in the nasal cavity are going to help filter that out. So there's almost like a filtration system that we wouldn't get if we breathe in through the mouth. Also, the nose is going to, or the nasal cavity is going to help humidify the air and also warm it before it makes its way to the lungs, because our internal, right inside of the body, it's wet, it's moist, it's warm. So we want to introduce air that's as equal to the body as possible. So the nasal cavity also kind of accomplishes that. So in the nose, right, we'll go into the nose and then into the nasal cavity. Um, so then, as we continue to go further into the nasal cavity, we'll eventually hit the back of the throat, which is the pharynx. So the mouth and the nose will both connect or get you to the pharynx. For those of you that have been laughing, sometimes when you're drinking a certain liquid, right, it'll come out your nose sometimes because they're pretty much connected in that way. So the mouth and the nose will get you both into this pharynx, which is essentially the back of the throat. Oh, and also for those of you that have had the flu test or the COVID test, they'll take a very big sort of Q-tip and they'll insert it into the nose or the nasal cavity as much as possible to collect a very good sample of the mucus that they're trying to get, which could have flu or COVID. So for those of you that have had it, it can be very painful, very uncomfortable, because they're going very far into the nasal cavity, and in some cases you might bleed. I think there was a case, and don't quote me on this because I know I saw it, and I'll find the link, where somebody got tested and they pushed it so far to the back that they punctured. Oh man, let me look it up because I don't want to give you guys false information. Right. You guys hear about that? I don't know if you did. Oh, I heard about it on the news. Oh, here it is. COVID-19 test caused brain fluid leak in U.S. patient. So it was super rare, but if you go far into the nasal cavity, I believe this is how the Egyptians used to take out the brain, was through the nose when they were mummifying the body. But yeah, I remember when I read that. That's pretty intense because it go very far into the skull. So, anyways, not to freak you guys out. It's super rare, but I just remember like learning about it and thinking, oh my gosh, that's extreme. But anyways, so let's talk about the nose a little bit. So the nose hairs will help to filter out any debris that's in the air that we're breathing in. And then there's also mucus, right? There are boogers that help trap any of this debris as for an extra level of filtration. And then in addition to that, we have these little hair-like structures called cilia, right? So cilia, if my fingers are cilia, what they do is, as these specialized cells with cilia line the respiratory tract, the cilia kind of be up this way, and they help to remove any mucus, right? Because we have a lot of mucus in the respiratory system. There are specialized cells that produce it. And they help to kind of remove any of that mucus that has debris trapped in it. Coughing also helps us to clear our airways. So by coughing, we're forcing air out of the lungs to remove whatever's in the respiratory tract. So if you guys have ever, I don't know if you have heard of, well, I swallowed the food and went down the wrong tube. Like if you have liquid or food sometimes go into the trachea instead of the esophagus, you'll start to choke. And so coughing helps to force that out. The Heimlich maneuver is also kind of used for that. So somebody was very forcefully pushing on your diaphragm to push the whatever's lodged in your trachea using whatever air is left in the lungs as sort of like to help propel that out. And so what can happen with smoking, and I don't know about vaping because vaping is seen as a safer alternative and it's pretty new to smoking. What can happen with people that are long-term smokers, the cilia that lines the respiratory tract will be damaged. And so rather than having these specialized structures push the mucus out of the respiratory tract and clear it, people that smoke for long periods of time will develop a smoker's cough where instead of having the cilia do this for them, they will forcefully cough constantly to clear their airway since the cilia aren't doing it for them. So smoking, that's one of the side effects of cigarette smoking where you damage those cilia, and so now you have to cough and cough and cough to remove the mucus buildup and remove the debris that gets into the respiratory tract. Am I presenting I'm sharing my screen, right? Okay. So the pharynx is the back of the throat. And so if you think about it, right, we're not only introducing debris, but we can also introduce bacteria or viruses. So it would make a lot of sense that we have immune cells and lymphatic tissue of the immune system to help fight off any bacteria or viruses that are getting into or trying to get into our airways. So we're going to see that the tonsils are located in the pharynx. And so here you have the pharynx, it's the back of the throat. Here you have the uvula, but here's the tonsil. And so our tonsils can become inflamed if we come into contact with some bacteria or viruses, and they'll become inflamed because of the inflammatory response and the immune system sending the bacteria and viruses to those tonsils, which are part of the lymphatic system, the immune system. And some people will get their tonsils removed because they are constantly swollen, so it hurts them to swallow or there's pain and discomfort. But the role is kind of an immunological, tonsils have an immunological role to help remove any bacteria viruses that are getting into the pharynx through the nose or the mouth. Okay, so we continue our journey down the respiratory tract. The next stop is the larynx or the voice box. You may have heard of laryngitis before where people will lose their voice. And so it's an inflammation of the vocal cord. So in the larynx, you're going to have some muscles and a set of, I don't know what kind of tissue it is, but they're called vocal cords. And as they vibrate, they create different sounds. And as we relax those muscles and tighten those muscles, we'll create different pitches. So I linked a video into your Google Classroom. I'm going to share it with you. You won't be able to hear the sound, I don't think. But that's why I did link it if you want to watch it. I know there's one on YouTube where you actually see a beatboxer. Because with beatboxing, they're using they make a lot of sounds with their mouth and their voice box or larynx, and so you can see it in action. And so here you see the larynx, so it comes after the back of the throat, which is the pharynx. And so you're going to see the vibration of these vocal cords. You're not going to be able to hear the audio in my video, but you can see how they vibrate. And that's how we produce sound. That's what creates that sound that we know as our voice. So you can see as they relax it, you can really see that there's an opening that'll go further down. And if you're a singer, you'll warm up your vocal cords, and just by relaxing them, you can create deeper sounds, right? You're relaxing them and it creates a different frequency. And if you tighten them, you create higher pitch sounds. So you're really just working with your larynx there. But you can see that when they relax it, we're now going to go into this tube now called the trachea. And so the trachea now is our windpipe, which will continue now into the lungs. So past the larynx, you have the trachea, and that's what you feel as those ridges. So the trachea is made up of C-shaped bone and cartilage. It reminds you of the bendy straw. And it goes pretty deep into the chest, so it's a very long tube. It just so happens that our trachea or our windpipe is right next to our esophagus for food. So it does happen sometimes where the food will get lodged into the windpipe or the trachea. And so if we're talking or we're breathing or we're taking in air as we're eating, that can happen. So that's where choking will increase because you're opening up the airways. So there's actually, and we talked about it in the digestive system, there's a little flap of skin called the epiglottis where when you are eating, the epiglottis will cover the trachea so that food can't get in there. But if we're laughing and we're talking, if my hand is epiglottis, it'll open and then food gets lodged in there. And that's where we want to cough or do something to force that out of our airway. Okay, so coming back here. So the trachea continues down pretty far into the chest, and then it's going to branch out into two sides, which are the left bronchus and the right bronchus. And so the bronchus is how the trachea will then branch out into each lung. Now, when we look at the lungs, you're going to notice that they're not exactly symmetrical. Like they don't look symmetrical. They're not the same. And we also see that the one on the right is called the left lung, and the one on the right, sorry, the one on the left is called the right lung. Why is that? So if we're looking at this
Because
image,
we're looking at it in anatomical position.
beautiful, very good. That's right. We're looking at it in an anatomical position. So this is, this is their left and this is their right. And so thank you very much. That's exactly right. And so that's why if you're looking at them and you're confused why those are labeled that way, that is why. But I want you to notice how the left lung has a little notch. You can see kind of it digs in or it goes in on one side, and that's because the heart is nestled between the lungs. So when somebody says the Pledge of Allegiance, they put their hand over their heart. Normally they're kind of doing it off to the left because your heart is a little bit off to the left, and therefore it goes into the left lung a little bit and it creates that little notch. So that's one way that you could tell them apart. Another thing that you'll notice about the lungs is that they are made up of these sections or lobes, and the right lung has one, two, three lobes, and the left lung only has two. So they're not necessarily anatomically the same. So lungs are actually kind of, I want to call them squishy, but they're going to have to fill with air and expand. And so they're very flexible. And I'm going to show you a video of a smoker's lung versus a non-smoker's lung. And we're going to see these inflated. So let me send you the link. So if you want to watch it also at a later date. Thank you, Jocelyn. That's right. Okay, so I'm going to play it. You won't be able to hear any sound. And so again, vaping is seen as a safer alternative than smoking, but it is known that smoking cigarettes will damage lung tissue because of the additives and then the just effects of the smoke within the lungs. Pollution can also damage the lungs. So, like if somebody lives in a very large city and they're constantly breathing in a lot of the pollutants, like the car exhaust and things like that, they'll find some of those, like the speckled sort of darkened appearance within the lungs. But what we see is, so here would be the trachea, and then the trachea branches off into the left and the right bronchus, and we're going to see how they expand them. But just so you have an idea of how they inflate and how they grow in size as we fill them up with air. So she's talking about how they're cancerous lungs. They're not going to inflate as much as a little more resistance. So she's talking about the recoil. So when she inflates them, they snap right kind of back into place. Okay, but you can see how they're growing. It says I'm going to go over to the healthy lungs. And so you can see how they're inflating. So when we take a breath, that's called inspiration or to inhale. And when we breathe out, that's expiration or exhale. And so you can see the lungs there. So as the person's exhaling or expiration with the healthy lungs, it's a slower, more fluid movement than with the smoker's lung, which is very rapid, very quick. It's like they're thicker, almost like scarred up tissue. So now, as I was talking about, I didn't find it here, but a couple years ago, I want to say like 2 or 3 years ago, there was a lot of media attention on popcorn lung. So for people that smoke e-cigarettes or use, I think it's like Juul, or that's the brand name of one of them, but or vaping. They're seen as a cleaner alternative to smoking, and so a lot of people will turn to that instead. And then there, of course, you have, I think, flavored cartridges, so it makes them more, I guess, tempting to try because it's like, okay, I think like fruit punch. Or I don't know. I haven't tried them, but I think I've seen flavors like they have mint and a bunch of different flavors. So more people may be tempted to try them because I guess I don't know. The flavors involved are just it's an alternative to smoking. And so with these cartridges, they found that with some specific brands, there was a specific additive within these little cartridges for vaping that was damaging the lungs pretty severely to the point that there were some very young people that were needing lung transplants from the permanent damage that was caused. And so this was called popcorn lung because the additive that they found in the cartridges is also added in popcorn. So if you guys like buy microwavable popcorn, it has that same sort of oil to it. And so if you're eating it, obviously it's not going into your lungs, so it shouldn't pose a problem. But if you're smoking it, then that's where they were seeing this popcorn lung. And so the long-term effects of vaping, I mean, I don't think they're very clear yet because it's pretty new technology, but we can see the consequences of cigarette smoke here in these lungs. Okay, so as we go into the lungs, right? So here we're super zoomed in. Let me zoom out a little bit. So we have the right and the left bronchus, and then the bronchus is going to branch out into these little, almost look like branches to a tree, and those are the bronchioles. So you may have heard of people that develop bronchitis, and with bronchitis, these little tubes that go into the lung to supply the oxygen and remove the carbon dioxide are swollen, so it becomes very difficult for the person to breathe. It's described as trying to breathe through a straw, like you're not getting enough oxygen into the lungs because of the swelling to these bronchioles. And then at the very, very end of these little branches or these bronchioles, you're going to find the alveoli. And this is the final destination of the oxygen. So alveoli, they look like little clusters of grapes. And as we take a breath, eventually the oxygen is going to make its way all the way down into the alveoli. And this is where the blood is going to pick up the oxygen that we breathed in or inhaled. So the alveoli is a site of gas exchange. And so you're going to notice in this picture, we have three different colors, and each color is going to tell us the oxygen content of that blood. So at the alveoli, you're going to see that it's kind of surrounded by what looks like mesh. Those are capillaries, very, very, very fine blood vessels. So when we see red, that is showing us that at this artery, the blood is picking up oxygen. So red is oxygenated blood. When we see blue, that's showing us that now we're dropping off carbon dioxide to the lungs to exhale. And so blue is carbon dioxide rich blood, so it's low on oxygen. And purple means that there's a mixture of both because we're using the same blood vessels here at the capillaries for that gas exchange. So we see purple because it's a mixture of oxygen rich and oxygen poor blood. And so we're going to see that the heart and the lungs work very closely to get oxygen into the body because remember, we have a very short time frame that we can survive without it. So when we take a breath and we're taking in oxygen into the lungs, it goes through all of those anatomical regions that we talked about, like the nasal cavity, the pharynx, the larynx, the trachea, the bronchioles, the bronchus, the bronchioles. And when it ends up in the alveoli, that's where the blood will then pick up the oxygen, and then that blood gets sent to the heart, and then the heart is going to pump that oxygen-rich blood we see here in red, that's an artery, and then the blood will deliver that oxygen on red blood cells to the cells all throughout the body. Once the oxygen is delivered, those capillaries are going to pick up the carbon dioxide because we also have to get rid of that. And then the veins now are going to take that blood back into the heart so that the heart can now pump it to the lungs to exhale. So the respiratory system is doing double duty. It's bringing in the oxygen, but it's also removing the carbon dioxide. So we do want to get rid of that waste. We need to keep a balance of CO2 because it actually helps to retain, like keep the pH in our blood. So I don't know if you guys have heard of people hyperventilating when they're breathing too quickly and they get lightheaded and sometimes their fingers will get tingly. I don't know if you guys have ever had an anxiety attack or a panic attack where it throws off your breathing and you start to feel dizzy and you start to feel tingling in your hands or numbness because you're throwing off the CO2 balance in your bloodstream. So we do need to have kind of this balance of oxygen and carbon dioxide. And so one of the concerns I know with wearing a mask, and I'm doing double duty. Yes, Katie, is that you?
Feels like you're suffocating.
Yeah, it feels like you're
I've
suffocating
had
because you're
panic
not taking
attacks.
deep breaths.
It's
So
the
have
worst
I.
feeling.
It sure is. I know that I used to suffer from real bad panic attacks, and I ended up calling the ambulance like more than once because I really thought like that was it. Like it's a very scary feeling, and your heart rate's beating really fast, and you're a fight or flight. It's a shortness of breath also because you're taking very shallow breaths. But one of the concerns about wearing masks, and like I'm having to do double duty now because I'm a hypochondriac like that, is that people were concerned of, well, am I going to build up carbon dioxide in my mask? Because that's, we don't want, we need to get rid of that carbon dioxide. It's a waste product. And so some studies have shown, I've seen videos of like, and you have to consider also like medical professionals have to wear these for long periods of time. But where they measure the oxygen content using a pulse oximeter, and it shows that having masks on is not affecting their oxygenation. Although I will tell you, and I don't know if it's a psychological thing, I'm sure there's some sort of effect, but I feel short of breath. And I think it's just because the oxygen, I mean, it's up on my face, and maybe I'm not able to exchange it as quickly as my body would like. So there are some times where I just need to stop, like when I'm talking, because I think I'm producing more CO2 than I can remove. So perhaps there's a slight effect, but I know like I feel it. Like sometimes I'm just like, oh, I want to rip this thing off because it does affect. I feel a little bit short of breath. Um, okay, so I was going to show you. Okay, so those are the alveoli. So the alveoli are the site of gas exchange. Now, if you recall a little bit of histology, and we were talking about epithelium, the alveoli are lined by simple squamous epithelium because we don't want thick layers of cells for the oxygen to have to cross through. So here you see the simple squamous epithelium that we learned about that lines the alveoli. So this is a site of gas exchange. Now with COVID-19, the alveoli can get damaged because of the damage from the virus as it's damaging the cells and using them for reproduction, right, for using them as host cells. But also the immune system can target the alveoli in an effort to destroy the virus. So there can be a lot of inflammation, there can be a lot of damage. And so pneumonia can result from not only COVID-19, but other respiratory infections where there is damage to these alveoli. And so what that causes is a lack in oxygen exchange. So as the oxygen is trying to filter into the bloodstream, it can't because of the inflammation, because there's mucus buildup, because there's pus. And this eventually is pneumonia, and it can be life-threatening. So one of the very severe complications of COVID-19 is something called ARDS. I believe it stands for acute respiratory distress syndrome. And most people that develop that complication from COVID-19 need to be put on a ventilator to force oxygen into their lungs. And so with ventilation, we're going to look at the process. I don't think there's any sound, but they'll take kind of this metal probe. It has a light on it. They're going to insert it into the mouth, and they're going to use this to put a tube into the trachea. Now, the patient will be anesthetized because this is very invasive. So they'll put that very deep into the throat, into the pharynx. Then you'll see the larynx, which are where the vocal cords are out at. And then now that they have it, they've opened that up and it's exposed, they'll take that tube, endotracheal tube, and they'll put it into the trachea. So you can see the ridges there. Then they'll inflate it to keep it in place. And that tube will stay in the person's trachea and breathe for the patient, because at that point there's so much damage to the lungs that a normal breath is not going to send in enough oxygen to the body. So the ventilator is forcefully going to push oxygen into the lungs. So it's mechanically breathing for the person. Now, long term, you guys can look for it up on your own, but long term ventilator use, like if the longer the patient is on the ventilator, it seems to have a worse outcome because this can even damage the lungs because it's forcing so much oxygen into the lungs, and also the effects of the virus and all of the scarring and inflammation from the infection. Uh-huh.
My mom's actually a nurse practitioner, I think it's what she calls it.
Uh-huh. That's
She's like
awesome.
she's like a private duty nurse,
Uh-huh.
and she has a patient that's actually in the hospital because a nurse there, the little baby, it's a baby. She
Uh-huh.
had a trach, and the nurse had twisted it, and it
Oh.
had destroyed her trach completely.
Oh my goodness. So let me go to the picture here. So the baby, and so a tracheotomy, they actually put it in through here, right? So rather than going through the mouth, they make a little hole and they put it in through that little hole, and that's for longer term use. Let me find it for you guys. tracheotomy. Make sure. So they put it in through here. They put it in through the actual, like they bypass the mouth and they bypass all that and they put it in through here. So you're saying that the nurse that was taking care of the baby twisted that and damaged the trachea?
Yeah.
And so what's going on with the baby right now? That's terrible.
I think my mom had said that she had to transfer the baby over there to the Houston hospital.
Uh-huh.
Yeah.
That's really sad, and I hope they make it okay. But if once you damage that, it can be very difficult to repair. I'm sorry about that, baby. But yeah, I mean, those are very like extreme examples where you that person needs to breathe one way or another, and you got to help them out sometimes in those severe cases. But the longer you are on a ventilator, all of that forceful pushing of the oxygen through the alveoli can cause damage long term. So the best thing would be to hopefully recover as quickly as possible or not get to that point. So with pneumonia, the alveoli will fill up with mucus because of the infection. And it's not just COVID that causes pneumonia. It could be like the flu. It could be any other respiratory infection. Sometimes people will breathe in their vomit if they're under the influence of drugs or alcohol. Um, I'm not suggesting you watch this show because it can be very graphic. But there's a show, a very popular show called Breaking Bad, where one of the characters dies by choking on their own vomit. And it does happen sometimes. People are under the influence of drugs and alcohol, and so they are unconscious and they'll start to throw up and vomit as a result of the drug or the alcohol. And so if they're on their back as they're throwing up, they're breathing in that vomit. Or if they're on their face as they're throwing up, they're going to inhale the vomit. And so the vomit will end up in the alveoli. And of course, they could suffocate from that immediately or if not develop an infection. So if you ever encounter a person that's unconscious, you want to put them on their side. Just as a precaution, even if they're not throwing up or anything, you want to put them on their side because if they do start to vomit, that way the vomit comes out this way and it's not going to go into their airway. And so those are the alveoli, and that's where the gas exchange happens. And that's the final destination of the oxygen there. So I think we covered all of the main parts of the respiratory system. So yeah, we talked about ventilation, we looked at the nose hairs, we talked about pneumonia, we saw the tonsils. Yeah. Okay, so here's just an x-ray. So you can see the ribcage and the lungs. Alrighty guys, so it's 2:20. I think we leave at 2:25. So if you guys don't have any questions, I'll dismiss you early today, or you can stick around if you have concerns about your average, or you have any questions. Bye guys, have a great day.
Bye, Miss. Have a good day.
Thank you too. Bye.